information can be encoded in many different dimensions, which makes recall of an experience, such as pain, very difficult to measure. Accurate descriptions of pain in a clinical setting is crucial to creating the most effective treatment possible for patients, especially those with chronic pain. Although research in the field of memory for pain is sparse, the research that is established suggests that while we have somewhat of an accurate ability to remember pain, we could have a tendency to either over or underestimate when asked to recall previous pain levels. The literature also stresses using nonverbal measures rather than verbal measures, which could potentially cause an individual to associate their pain with a word or number rather than his or her actual tactile experience. One of the main limitations in this area of study is that the nature of pain is subjective rather than objective, and there is no definite way to know if people recall their painful experience or just their ratings of pain. This is a memory for pain study that was conducted 2 years ago, and patterns of weights were presented to participants, and they were asked to recall their particular pattern immediately following the presentation of the stimulus or after a short delay. If they were asked immediately after their stimulus, they were about 76.8% accurate. If they were asked after a delay, they were about 58.6% accurate. This shows that as time passes after a presentation of a painful stimulus, people become less accurate about the nature of their painful experience. And while their confidence levels do drop, people, as you can see, are still fairly confident in their responses.
So as Susannah just said, previous studies, when they look at memory for pain, they usually ask the person to rate their pain from a 0 to 10, and then at a later date, they'll ask them to remember the pain that they had. So the big question was if they were actually remembering the pain that they had felt previously, or if they were just remembering that small number from 0 to 10 that they had said back then, which is probably easy to do. So our study wanted to examine memory for pain non-verbally so that they couldn't do that. So to demonstrate this in an easier way, first we're going to use color swatches as an example. So for our first study, we would show, with color swatches at least, you would show someone this color right here for 5 seconds, and after 5 seconds you would wait 5 seconds and have nothing there, and then you would present another color, and you would ask them if it's the same color or if it's a different color. And if it was the same, that's it. But if they said it was different, you would ask them if the second color was darker or lighter to see which way they went. And then for our second study with color swatches, you would present one color for 5 seconds, wait 5 seconds, and then you would show 2 colors, and you would ask them which one of those 2 colors matched the original color. So for our actual study, we had 56 people that were undergraduates, and we administered a baseline with 24 trials, and for each trial, we would just set one weight on the Forgeron-Barber device, and they would rate their pain from 0 to 100. So for study 1, we would set a weight on there for 5 seconds, and then take it off for 5 seconds, and then for 5 more seconds, we would put a different weight, or we would put another weight on there. And they would have to say if it was the same or different. And if it was the same, we would ask them how confident they were from 0 to 100. And if they said that the 2 weights were different, then we would ask them if it was more painful or less painful, and then also ask them their confidence for that. And for the second study, we would put a weight on for 5 seconds, and then we would wait 5 seconds with no weight on there. And then we would put a weight on for 3 seconds, and then right after that, take it off and put another weight for 3 seconds, and ask them to rate, Okay, so study 2, put a weight on for 5 seconds, and then you would take it off for 5 seconds, and then you put another weight on real quick for 3 seconds, take it off, put another weight on for 3 seconds, and then you would just ask them which of those 2 second weights that you placed on match the first weight, the original weight that you put on. So it's just matching to the original stimulus. And then you ask them their confidence for that. And for the baseline trials, we see that the force, as it went up with each weight, their perceived pain level also went up, and that just proves that the weights were significantly different.
For the results of study 1, there were 4 potential answers. They could either say that the weight was the same when the weight really was the same, and that was labeled a hit. They could say that the weight was the same when it was really different, and that was labeled a miss. They could say that the weight was different when it was truly the same. That was a false alarm. Or they could say that the weight was different when it in fact was different, and that was labeled a correct projection. These are the mean responses, and what we see is that for the 2 correct responses, the mean is between 70 and 75, and for the 2 incorrect, it's between 30 and 25. So for the decision confidence, what we found was that in instances where they were correct, so hits and correct projections, the confidence was higher, but it was not significantly different from when it was incorrect, such as false alarms or misses. With correct projections, they went into a second step because they said it was different, and they had to then determine whether it was less painful or more painful. And so what we labeled individuals that correctly rejected Ubers. And so if you correctly rejected, saying that it was different, and then you got the correct difference, so lighter or heavier, you were labeled as an Uber. What we found was that the Ubers were accurate 70% of the time, which was the same as any other correct response. What was interesting was when we looked at false alarms. So with a false alarm, the weight would be the same, but you would say it was different. You would then be asked whether it was lighter or heavier. What we found was that when the weight was the same, but it was a lighter weight, so light or medium, there was about an even distribution between whether you reported as lighter weight or less weight, more painful or less painful. When the weight was heavier, so heavy or extra heavy, they were more likely to report that the second weight was more painful. And we hypothesized that this occurred because the memory for pain diminishes, even across a 5-second interval. So when they are exposed to the second heavy weight or the second extra heavy weight, it seems more intense than the actual initial weight.
So participants were really good at matching the stimuli, the original stimulus, with one of the second 2 stimuli that were presented. And they were able to match 76.4% of the time, which is greater than chance, so that's very significant. And it's also similar to study 1, in which they answered correctly 71.7% of the time. And when they made a mistake, as you can see, there was a significant bias towards indicating that towards choosing the less painful stimulus rather than the more painful stimulus. And this is their confidence levels. There was no significant difference in how confident they were across them. Okay, and then when it came to the decoys, what a decoy was 4 of the trials didn't have a match. They were just like light, medium, heavy, or some order like that. And we found that with the decoys, there was also a significant bias towards selecting the less painful stimulus. And as previously stated, people remember past pain experiences as less painful than they actually were. So we believe this led participants to choose the less painful decoy because it best matched their memory of the original stimulus. And again, we found that there was no significant difference in confidence ratings. So in conclusion, from our study, we found that people were reasonably good at correctly recognizing pain intensities. It was between about 71 and 76%. At this point, it appears people remember past pain experiences as less painful than they actually were. We believe that the results indicate working memory processes. However, we suggest that future studies examine how longer delays between the presentation of the stimulus impact their ability to recognize the stimuli. And we also suggest that future studies increase the number of trials, which will allow there to be greater than 4 decoy trials, and which will also allow us to better observe the differences between the stimuli. And we also suggest that in study 1, that the number of differences are balanced.
Are there any questions?
heavier weight, where they tended to overestimate the weight of the subsequent.
Sorry, right there with false alarms.
If there's any possibility of a kind of a tissue trauma effect, from the heavier weight, and that that delay, there may be something involved with the possibility of some kind of a tissue trauma. It's like when you have a sunburn, anything lighter than that, you feel like pain.
Right, and it's a very interesting question, but we have to do this study within one semester, so we couldn't go into that level of detail.
No, do you think that's
So that's a very interesting way to possibly explore, and so a future study could look into that. And if we talk about somatosensory and pain, like we talked about in class or a while ago, Dr. Pittman, you find that light stimulation of the skin around the trauma reduces the pain sensation because it's a lower stimulation. So that could potentially be something, but that's not something that we were able to look into. Is that a question? No.
Okay. I know that you guys, we were excited about, looking at John, about the spatial span task that got created, the Corsi task, because I got asked about getting an external measure. Did you guys correlate that with anything or end up using that measure with
We
anything?
didn't find any correlations.
But you tried it.
We did try. We did try.
We did, every person
Everyone
did.
did the
If
Corsi.
you want the data, we got it.
Yep.
I'm excited. You got this external Corsi task and,
We built
You
it,
built
the
it?
blocks, the whole
Did
thing,
it?
yeah,
I know.
nothing.
okay.
Is there anything else?
Okay, thank you very much.